Hi, I'm Dr. Cynthia Gregg, and welcome to my presentation today concerning rejuvenation of the upper face. This presentation has been pre-recorded, but you can submit questions as you watch, and at the end of the presentation, I will go live and be able to answer any questions you've submitted. But before we start talking about rejuvenation of the upper face, I think it's important for us to talk about the aging process. What happens as we age? A lot of us think that aging is very much represented in this diagram of an inflated beach ball in our 20s that slowly deflates over time. Aging is much more multifactorial. There's so many complex things that occur. This next slide, I think, is a better representation of what really happens with the aging process. And this slide shows a daughter and a mother. And you can see that not only is there deflation, but there's also descent of soft tissue. This slide also represents that one of the most common reasons why we age is genetics. But there are other factors that we do have some control over. We can control our smoking history, we can control the amount of sun exposure that we've had, and we can try to limit the amount of stress in our life, because excessive sun, smoking, and stress all will accelerate your genetic predetermined aging process. So what happens as we age? Well, this slide shows that. There's a young child and a more mature gentleman. And you'll notice that the first thing that happens in our 30s is that we start having loss of elasticity and thinning of our skin. We start losing 1% of collagen every year after the age of 30. And as a result of that, we start seeing greater visibility of the bony landmarks on our face and the vessels in our skin. We start seeing lines across our brow, between our brow, around our eyes, lines down around our mouth. Our brows can actually drop. In our 40s and 50s, this slide represents other aspects of aging. So not only does our skin thin, but we start losing volume. We start losing volume around the eye. We start losing volume around the mouth. We get a deepening of our nasolabial groove, the groove that goes between the base of the nose to the corner of our mouth. We start losing bone in our 50s and 60s. So loss of bone here on either side of the chin accelerates the appearance of the jowl as the soft tissue descends downward. So not only do we deflate, but we also descend. It's imperative when patients come to see me with complaints that can range from I'm tired looking, I'm angry looking, people think I'm sad, people think I haven't had a good night's sleep. It's imperative that I'm able to correctly diagnose what's the cause of this aging of the upper third of the face, because you have non-surgical options and you have surgical options. Right now, we're going to talk about the surgical options. The most common reason when people come to see me with a complaint of having a tired, sad look around the eye is a condition called dermatochalasis. And dermatochalasis is a condition where you have excess skin and soft tissue on the upper eyelid. Probably the next most common reason that I find in my practice is a low brow or a droopy brow, what we call brow ptosis. And a third reason that's not as commonly seen but very important to diagnose is whether or not a patient has eyelid ptosis. And eyelid ptosis means that their eyelid itself is sitting too low on the eyeball or sitting too close to the pupil, and this is causing a very tired or sleepy appearance to the eye. So the way that we correct dermatochalasis or excess skin of the upper eyelid is to do an upper eyelid blepharoplasty, as represented with the slide at the top picture. That top eyelid with the blue line shows you the incision site for performing upper lid blepharoplasty. Excess skin, soft tissue, and muscle is removed, and the incision is hidden very well in the eyelid crease. We do have to extend the crease slightly out to the crow's foot to completely remove the excess skin there. There have been some advances, though, in how we perform lower eyelid surgery. One of those advances is that the classic incision was a mirror image of the upper eyelid incision as seen on the picture on the left. And that was an incision that was placed underneath the lashes on the lower eyelid. Instead, I've chosen in my practice to perform a transconjunctival approach to the lower eyelid. The advantages of this is that the scar is hidden. It also has a less risk of malposition of the lower eyelid postoperatively. Another advancement in lower eyelid surgery is that it used to be that we would go in and just remove the fat pad or the bags that were bulging out from the lower eyelid. Instead now, we've learned that just gives you a sunken look or an aged look. And instead, I want you to have a youthful look. So we do much more fat preservation and fat repositioning of the lower eyelid. So here's an example of one of my patients who came to me with a complaint of having a tired, heavy look to her upper eyelids. And she had dermatochalasis, or excess skin and soft tissue on the upper eyelid. Her brows were in a good position. She was not concerned about her lower eyelids, just the upper eyelids. And so here she is 4 months after surgery with a nice rested improvement in the appearance of her upper eyelids. Here's the same patient 4 months after surgery, and you can see the improvement in the amount of platform she has of her upper eyelid, an area where women like to put our eyeshadow. In case you've just joined us, please feel free to submit any questions, and at the end of this presentation, I will go live and answer any questions you may have. This patient came to me, and she actually needed upper as well as lower eyelid surgery. So let's talk about the upper. If you look at her beforehand, she's really working hard to hold her eyelid up because she had so much excess skin and weight pushing down her eyelid that she felt like she had to really hold them open in order to be able to see very well. And look how much more relaxed she is in the after picture. She's a great example of the improvement that we can do with lower eyelid surgery. She had significant fat pads bulging underneath the lower eyelid, and you can see the outline of her bony eye socket. And look at the much more youthful, rested look she has 3 to 4 months after surgery. This profile view is a nice representation. Again, you can see the nice natural look of the upper eyelid, but this view really shows the nice eyelid cheek contouring that we can get by not removing the fat, but by preserving the fat and repositioning the fatty tissue. We talked about dermatochalasis being the most common condition, or having too much skin on the upper eyelid, and we've just talked about how we can improve the lower eyelid appearance. But now I want to spend time talking about a brow lift. A brow lift also means a forehead lift. This picture on the left shows you all the various incisions that we as surgeons can use to perform a forehead or brow lift. The 3 most common brow lift incisions are shown in the middle. And probably one of the most common, and the one that I was trained on originally, is that blue line. And that blue line is called a coronal forehead lift. It's basically an incision that goes from one ear to the other, but it's hidden behind the hairline. And a variant of that incision is that green line called a pretracheal incision. And that's just like the coronal incision, but instead of being hidden behind the hairline, it goes right along the front of the hairline. Why I use the endoscopic approach, which is represented by the red marks, is that it's a minimally invasive approach, 4 small incisions, so there's less risk of bleeding, less risk of hair loss, less risk of numbness, and I really feel that the result you get with an endoscopic brow lift is a much more natural, not a surprise look. Here's an example of a patient who came to me with a complaint of a tired, heavy look to the upper third of her face. And on exam, we determined that she had excess skin and soft tissue on her upper eyelid, or dermatochalasis, but she also had a component of brow droop. So here she is 1 year later, after having undergone endoscopic brow lift and upper lid blepharoplasty. And here she is before, and 1 year again after undergoing an endoscopic brow lift and upper eyelid blepharoplasty. But there's also an area that is often overlooked when looking at why the upper third of the face has a tired, aged appearance, and that is loss of volume in the temple. So temple volumization is another tool that we have to improve the appearance of the upper third of the face. When we're younger, our temple is very flat or convex, and as we get older it becomes concave, and when it becomes concave it actually can contribute to loss of lateral brow support. The fillers that we have available in the market today range from hyaluronic acid to calcium hydroxyapatite to polylactic acid, and all of these are useful in this area. In our office, we have state-of-the-art imaging. We have a 3D imaging system that we use, and you can tell on the left that our estheticians and our skincare nurses can use this to look at hyperpigmentation and vascularity of the skin. But as you can see my picture there in the blue background, it can also show volumetric loss of volume in the face. And you can see that the very light blue shows loss of volume in my face. And then the pictures below me here are 3D pictures of me on oblique view, and these are wonderful tools that we have in our office to really analyze your facial volume. So here I am on the left, showing that I've got a slightly concave temple on both sides, and here I am on the right 2 weeks after receiving 1 syringe on each side of my temple. And it's important to note that no Botox was used during this treatment, because sometimes Botox can help improve your brow position, but only here this is due to the temple. Our 3D imaging system gives us ability to have this gray rendition done, and this will really show you, if you look here at my left temple, the amount of concavity that I had from volume loss, and 2 weeks after 1 syringe of filler to each side, the amount of improvement that I had in my temple. I think this slide shows you that before any filler, I had a very relaxed or lost support of my lateral brow on the right side, and look how much better positioned my right brow is simply after augmenting and replacing volume in my temple. So in conclusion, we've talked today about what causes aging. We've talked about that we age first in the top third of our face, and when you come in, it's imperative that we correctly diagnose what's causing the issues that you're concerned about. Once we figured that out, I'm then going to go over with you non-surgical and surgical options. Neuromodulators such as Botox and Dysport and Xeomin are all great tools to help. Also, filler to the temples, as I just mentioned, is another great tool that we can use. But there's going to be a point where non-surgical options aren't going to give you the result you want, and we're going to need to turn to surgical options. And we have the option of upper eyelid blepharoplasty. We have the option of lower eyelid blepharoplasty, and then if you need it, we also have the option of an endoscopic brow lift. Each of these incisions can be performed alone, or we can perform any of them together, and we can perform all 3 if they're necessary. So thank you for watching. We're now going to go live, so if you'll now go to the top logo on the top right of your screen and click on that, and then go back to our playlist, I will join you live to answer any questions you may have. I really appreciate you joining me today for this presentation. Thank you.